Root tip resection with orthograde filling refers to the surgical removal of a root tip and the cleaning of the tooth canal working from the crown area. A root tip resection is performed on the root tip when a patient is suffering from chronic bone inflammation. You can find out how this happens in the video entitled Root Tip Resection. Here we see a film of a root tip resection with orthograde filling. The patient fell years ago and injured the left frontal incisor. He did not visit a doctor. And over the years he observed tooth movement away from the center line as well as dark discoloration. The tooth nerve was damaged during the fall and died. The rotting tissue caused an inflammation in the bone, specifically on the root tip, and led to cyst formation. Here, the tooth has already been opened from behind, and next follows the gum edge cut and the mucosa lobe preparation. Using a rose grinder, the bone is removed above the root tip, exposing the cyst. The cyst and the cyst content is cleaned out with a special spoon. Now the root tip is cut and removed. Next, you see another instrumental root canal cleaning. The area is repeatedly flushed with special solutions in order to remove tooth particles and tissue residue that were cut off during the grinding process. Lastly, the canal is dried with a paper tip, and the clean canal is filled with sealing cement again. However, it's important to note that the cement contracts during the hardening process and potentially creates subsequent microfissures, which would be potential entry points for bacteria. So the cement is kept as thin as possible with the help of a bar. Here, the bar is pictured in red. A narrow cement gap means less contraction and, therefore, smaller leakages. All of this is controlled with a mirror. Surpluses are removed after the hardening process, and the opening is once again cleaned. At the end of the surgery, bone substitute material is inserted because the defect was rather large. This should only be done if there are no inflammation symptoms present and the defect can be properly cleaned. Finally, the mucosa is sutured and the surplus is removed. The tooth is then sealed tightly from behind. You now see the sutured lobe and the final inspection with a mirror. Seam removal is done after a week, and X-ray control is every 6 months. If everything was successful, bone will rebuild around the root tip. This is a root tip resection with an orthograde filling. An alternative to this surgery would be tooth extraction. The risks associated with root tip resection are negligible if performed by an experienced surgeon. However, there can be complications in isolated cases that may require additional measures. Any additional measure required can then lead to further complications. These can eventually become life-threatening. Here, we will only discuss root tip resection-specific complications. For example, bone inflammation or osteomyelitis due to non-adherence to hygiene standards during surgery. Injury to neighboring structures such as the tongue, cheek, nerves, blood vessels, neighboring teeth or roots, and related consequences such as sensation disturbance in the tongue and/or lips. Wound infections due to non-adherence to conduct rules, for example, sinus cavity openings, which can then lead to sinusitis as an additional consequence. Inflammation recurrence after surgery. Incomplete resection from overlooking of roots or root parts. Luckily, such complications are very rare today due to medical advances over the last few decades.